I think one of the highlights for me was having the privilege to chair the hypoglycemia symposium, which was looking at, I guess they could be called hot topics in hypoglycemia, which is obviously very important for our patients. If we look at hypoglycemia, one of the really important things that is developing is continuous glucose monitoring. Blood glucose monitoring was invented, if you like, and brought into clinical practice in the late 1970s, which is many years ago. And ever since then, patients have had to measure their blood glucose by pricking their finger and making measurements. Now, that was a revolution at the time, but it's painful, it's difficult, and most important of all, it doesn't measure their glucose levels when they're asleep, for example. So now continuous glucose monitoring has reached the clinical arena, and although it's been very expensive, it's now becoming reimbursable across the whole of Europe, and actually we heard just yesterday that it's going to be prescribable in the United Kingdom. And so as a treatment for hypoglycemia, I think it's going to be truly a revolution. The biggest challenge is to engage the patient in the management of their own condition. That's obviously true for type 1, which is very challenging. But if you think about type 2 diabetes, patients get diabetes because they've been making, inverted commas, bad lifestyle choices for their whole lives. They get diabetes and they suddenly have to change those. And I think we as professionals totally underestimate how difficult this is. And we really aren't very good at working out what is needed to help them make those big changes.